right, so I want to make sure that I am giving explicit instruction as to how we want alginate impressions done here at Carolina Career School. So one of the reasons why we take alginate impressions, number one, is study models, bleaching trays, partials. We're going to highlight just those instead of going into many other reasons why you may take it, wax up, etc. The things that you're going to need is, and you're always going to want to have out, you're going to want to have your regular set or fast set alginate material. We do not use the squeeze stuff in the guns. It's very expensive, and you can go through just one cartridge with one patient if you don't get everything perfect the first time. So, big fan of this. Been in dentistry a long time. This is old school. This is what works. We like it.
That's right.
We're gonna go and go ahead and have both bowls out. So we're gonna do an upper and a lower. So a bowl for your upper and a bowl for your lower. Your flexible spatula. The correct measuring for your water. Pay attention to when you get your alginate in through your supplier. If it does not come with a water dispenser and you grab one from a different brand, it will mess up your ratio. And as we all know with alginates, water ratio, powder ratio, and the temperature of the water are big factors in messing up your alginates. So you got to make sure you got the right water dispenser to the type of alginate that you have. Then you're going to want to have a small upper and lower, a medium upper and lower, and a large upper and lower tray to size. Once you become a seasoned assistant, sometimes you'll just know, you'll look at your patient and say, yep, you're a medium, or yep, you're a small. But until then, you're going to want to have all three sizes out, upper and lower, until you start getting used to it. So we have those out. You're going to want to always have your PPE on. I don't have a mask on right now, but that's okay. You won't be able to hear me or understand anything I'm saying if I have one on. And this is for instruction. The other thing is your gloves. And some people will say to have safety goggles on. I'm okay with not having them on. So just personal preference, because sometimes you will fly alginate around on the walls. It happens. It's okay. So we're going to go ahead and we're going to take upper and lower study model impressions today. So I am going to first size the tray. And the reason why I'm going to size the tray first is so that I know how much powder I have to have. I'm a big with not wasting on alginate, but you got to have enough also. If you've got a large upper, it's going to take 3 scoops. Most of your larges or most of your lowers are always going to take just 2 scoops. Medium upper, small upper especially will just take 2 scoops. But I always like to have extra because you got to try to get that vestibule, get all that on that upper that I'll show you in a little bit. Without enough overage, then you're not going to capture that sometimes. So I'm going to go with Addison. I'm going to size a medium and a medium. Now, the first thing, when you go to talk to your patients, you want to take away any fear that they may have. Something about they might have heard from somebody, or, oh, this made me gag, or, just horror stories. Do not start off the conversation with, this is going to really suck and let's just get through it, okay? We don't want to set that into play. That's not where we're letting them know it's going to be great, it's going to be fine, no worries, because I'm going to teach you tricks. I've never had a person gag on me, ever. I'm going to teach you tricks that'll actually keep you from having any problems. And it is not wiggling our toes or going off to the beach somewhere. It's anatomical, true means of taking away the gag reflex. So what we're going to do is we're going to tell ask our patients, have you ever had these done before? And they'll say no, or they'll say, yeah, it's horrible. And we're going to say, no, it's not horrible at all. It's actually very easy if you just listen to the things that I ask you to do while we're going through the process. I promise you it'll be really easy and you'll get right out of here, right? So what we want to do to build their confidence in that is we are going to start with the lower first. There is no gag reflex, okay? You get them to lift their tongue, the lower, and they're like, oh, this is easy peasy. And so you just set the stage for how everything else is gonna go, even for the upper. And I promise you it'll go the same way. So let's size. I'm gonna size your lower. You might get small one lower, you're narrow. So when you're sizing, you want to make sure that you have room to kind of wiggle a little bit. You're going to make sure that you got all teeth in the back. And I'm going to tell my patient that when I go to do this, I want you to stick your tongue out at me. It's the only time you'll ever get to do that in your life. Stick your tongue out at me, and then you're going to let it set up, okay? There's no gagging with this. So I ended up backtracking from a medium to a small. The small fit perfectly, and so we'll just do 2 scoops. So I'll set that lower tray aside, put that bowl here. I know I'm gonna do 2 scoops there. Now I'm gonna go to the upper. Let me see the upper. Small upper too.
My second molars flare out a little bit.
I am going to go with the medium. Now notice when I tried in the lower, I went to the front of the patient. When you take the impression, you're going to go to the front of the patient on the lower. However, on the back, you're going to go behind your patient, okay? The reason for this is because I will actually use my arm to hold them from backing up with me with the tray, okay? It's a natural response for people to go away from you, and it's not going to allow you to see your tray. So what you want to do is you're going to go into an angle. You're going to have it going in straight like this. You're going to use it to retract the cheek. And it slides in just like that. I need to be able to wiggle it. You can feel if I got all my molars. And there's no gagging. So how we take away the gag reflex on the upper is first I'm going to explain to my patient. On the upper, a lot of times people have some problems related to a gag reflex. So what I want you to do the entire time that I am loading the impression in, I want you to breathe through your nose. If you breathe in and out through your nose, you cannot breathe through your mouth. It causes your tongue to go back to your throat, and it takes off that airway, which takes away the gag reflex, okay?
Okay.
So the whole entire time, I want you to breathe in and out through your nose. Once I've sat it, and you're gonna feel my bicep, I'm gonna put you in a little headlock, okay? And it's because I don't want you going with me, okay? I need you to go against me so that I can seat my tray all the way, okay? And once I've sat it all the way, I'm gonna tell you to drop your chin to your chest, which also cuts off a gag reflex, okay?
Got it.
All right, so I have a medium. I'm gonna go with still 3 scoops because that's what makes me happy.
We want it.
So, yes. Okay, so make sure you always have your correct measuring cup to your brand of Alginate as well. And what I suggest doing is you're going to tap through and then slide, okay? Because if you have too much of this and not the right amount of water, that ratio is going to mess your setup time. So then I'm going to do 1. And on the lower, I'm going to do another. I'm going to slide, tap my next bowl for my upper, I'm gonna do 3. And sometimes people like to have, assistants like to have this already ready before the patient comes in. However, the humidity in the room can mess up your powder. And so, again, that will affect the setup time. And if you're not seasoned and you need as much time as possible to, you know, mix your alginate, you don't need the humidity in the air, which we have today. So with the lower, remember we do the lower first to build confidence for our patient. What I do is I cut it in half and I make a little well. I don't know if you can see that. Okay. Now here goes the water. So one trick that some newer assistants will do, if you have a refrigerator at your practice, if you keep a bottle of water in the refrigerator, you can use that water and it's colder. So the colder, the longer it takes to set up. The warmer your temperature, the faster it's gonna set up, okay? So we did 2 scoops. You must balance it on the table. If you are doing this, sometimes you can tilt it and it's not right, okay? So we are dead on that line. All right, Addison, you ready for the lower?
Ready.
I'm gonna do our water. Now, I always tell my patient that they will never leave the way they came in. It gets messy. So, you've got a nice little mix.
Come this way. I can't see. There you go, there you go.
Got a nice little mix. It looks like icing. I don't know, I can't tell you how many patients have asked me if I'm really good at baking. I am not good at baking or cooking. Great at dentistry though.
There you go. And
We
here
all
at
have our things.
Yeah, and here at Carolina Career School, dentistry is our thing.
That's right. Absolutely it is. Okay, so I take this, on the lower I'm gonna load on one side, and then I'm gonna go to the other side and load the other side, okay, and then swipe off. Now, a little trick is you can just put some water on your gloves and just even out your alginate a little bit. Have a paper towel ready though. All right, remember I'm gonna go straight in, I'm gonna retract the cheek, seat at the posterior, then round to the front, okay? Stick your tongue out at me. Only time you do that. So when they stick their tongue out, it pushes the alginate material toward the front so that you can use your glove, your finger, to feel if the alginate's ready or not. Almost set up. You're doing great. And you didn't have to go to a happy place or wiggle your toes. Easy peasy, right? Lemon squeezy. Okay, so when you're going to go take the lower out, what you're going to do is take your fingers, not your fingernails. In dentistry, you should not even have nails. What you want to do, again, remember I'm in front of the patient, I'm not behind the patient. You're going to go up underneath the vestibule right here and you're just going to pop that tray right out. Okay? And then have a beautiful impression. Woo woo, woo woo. Okay. Now, I got a mess. I just clean it off real quickly. Now we're going to go to the upper. I create my little well. See, sometimes you have to go back and forth, back and forth. Okay.
There you go.
There we go. Thanks for that napkin.
Always assistant.
That's right. You're gonna pour that in. I didn't make too much of a mess this time. I have thrown it on a wall before while I was mixing like this.
She wasn't kidding.
Y'all, stuff happens. If it makes a mess, it's okay. Just laugh it off.
That's right.
I did it right in front of a patient. Went slap against the wall. I said, well, we didn't need that, did we? Okay, so smooth icing look. Now remember, with the upper, we're gonna go to the back. And Addison, remember what we're gonna do. Also, I want to show you something. When you load this tray, you need to load from the back to the front, okay? Because everything comes out back this way if you're loading it from the front. I want everything to push forward, okay? Another thing we're gonna do is when we seat this, we seat to the posterior and bring up to the front. So everything comes out to the front, doesn't go down the throat, okay? Again, I do my little trick. All right, you ready?
Ready.
All right, I want you to breathe in through your nose. In and out through your nose. Straight in. I'm gonna go to the back. And I'm gonna pull forward. And drop your chin to your chest. So another reason why I need to have my arm on her is because it helps me fulcrum almost so that I can feel. A lot of things assistants do is all by feel. We can't see sometimes, like right now I'm not in her face, looking up in her mouth. I can feel with my fingers where I am. And you're just gonna breathe in and out through your nose. You're doing a great job. A lot of times if you have a patient who does get a little fight or flight because they're getting a little nervous and they feel like they're gonna throw up, when you talk like this and you speak in a calm voice, it will actually calm them. So you just want to say, it's okay. I want you to just breathe in and out through your nose. You're doing a great job. Breathe in and out through your nose. Put your chin to your chest. And the more, because I tend to be very loud, so I have to soften my voice and calm. And when you speak like this, it's in a pattern to their heart, so it helps them calm down. All right, when you go to take this out, a little trick. I want you to close down for me, Addison. They just close down as much as they can, okay? On the count of 3, I want you to open your mouth as wide as you can, okay? Now on 3, I'm gonna take this finger to the very back of the tray, and on 3, when she opens her jaw really wide, I'm gonna snap down and it will just come right out, okay? It breaks that suction that's created from the palate or the roof of the mouth. Okay, so close down as much as you can. On the count of 3, I want you to open really wide. 1, 2, 3. And come straight out. And
Woo! Look at
beautiful impression.
Gorgeous.
All right. Thank you so much, guys. Hope everybody understands.
It's still going.
I have to edit.